Sever's disease, this actually hits quite home. I'm seeing quite a bit this here in the clinic, and unfortunately, my son, my 10-year-old, is suffering from Sever's disease. So, Sever's disease typically affects active young children. More specifically, it is an irritation of the growth plate in your heel. So, here's a model of the foot and the heel, or the calcaneus. The growth plate on the heel typically is growing at such a fast rate, okay, you start to develop a lot of inflammation, irritation right on the heel. And so many times children will complain of, heel pain. You'll see them walking up on their toes. It's associated with a lot of young athletes, whether it's cleats that they're wearing or a lot of pounding on their foot. So it's inflammation of the heel. Kids will typically present with some form of heel pain, might even be getting up into the Achilles area, and it's associated with some form of repetitive activity. Treatment for this is, a whole host of things. And like I said, I'm probably seeing 5 or 6 kids in the clinic currently for this. The first thing is, with any type of inflammatory or any inflammatory condition or any inflammation, we want to do things to get the inflammation down. And we've talked about this in the past. We're going to use some ice on it. So there is so much value in simple ice, just 20 minutes on, 20 minutes on the affected area. It's interesting because I'm treating many of these children, these kids, and that's the last thing that they want to do. But I try to stress to the parents and to my son, just regardless if they hurt or not, that tissue, the bone is likely going to be a little irritated. And so we want to use the ice to get the inflammation down. Secondly, you could use some form of over-the-counter anti-inflammatory, whether it's Advil or Aleve. That will start to help bring some of the inflammation down. Compression boots, taping, those types of things can also help with some of the inflammation. So the first thing we want to do with Sever's disease, or this kind of acute inflammatory response to the heel, is work on bringing the inflammation down, and that's going to be treating the symptoms. Okay. So let's move into some things that we could work into, maybe fixing the problem or prevention. I think footwear is so very important. Many times with these kids, they're wearing, cleats, and they're playing on hard surfaces, whether it's turf or the ground could be quite hard. So I think there's value in an insert, whether you go just buy a generic gel type insert. All you're trying to do is give the foot a little more cushion or padding to try to reduce the irritation to the heel. So I would definitely invest in a good pair of shoes or cleats and look at buying some form of insert. Back on, managing the pain, when the kids come into the clinic, we're typically going to do some form of manual therapy, active release, myofascial, deep tissue, upstream. So if you can imagine, my calf muscle is up here, the Achilles connects and runs around. So if you could imagine the Achilles tendon is kind of like a bungee cord. If I was constantly yanking on that bungee cord, it's really going to start to tighten this area up. And as that calcaneus, or that heel, starts to grow, I believe actually the calcaneus is the first bone to fully mature in a lot of kids. So that bone is growing quite rapidly. So as that bone is growing, it has a tendency to put a lot of stress and irritation on that Achilles as well. So we likely will do some form of manual therapy upstream. So if we could relax the tissue here, hopefully it will reduce some of the irritation and some of the pull onto that tendon. High intensity laser. We've spoken about this in the past. Such a fantastic modality that we added to the clinic in the past few years. It's just, to dumb it down, it simply reduces inflammation with 0 side effects. I'm having some fantastic results in cooperation with deep tissue massage, icing, with the laser. And all essentially it's a high intensity laser. We're reducing the inflammation to the tissue, reducing soreness and pain, and promoting the healing process. So like most things that we do here at the clinic, it's kind of a combination effect. We're integrated care. That's what we're all about. We're utilizing multiple different service lines to reestablish function as quickly as we possibly can. So here, this is where it gets really challenging for a lot of kids as well, stretching. So we talked about managing the inflammation. We're going to do some things in the clinic to reduce the tightness in the calf muscle. We're going to use the high intensity laser to promote healing as well. So then we've got to continue to really have the child stretch the calf. So the lower portion is the soleus, and then up top is the gastrocnemius. So larger calf muscle transitions to the soleus, smaller calf muscle. It's very important that we're appropriately stretching both of these muscles. And that's the one with a lot of kids, they're busy. They don't recognize the value in a lot of stretching. So I think that as parents, we need to do a good job to, develop a good stretching program before and definitely after they work out. So Seaver's disease sounds really nasty, but it's a very, very common condition that affects a lot of kids, young kids, athletes, kids that are working through repetitive type sports activities, inflammation of the heel. Some good treatment options for us is we want to do things to reduce inflammation, whether it's ice at home, high intensity laser here in the clinic. We want to do deep tissue work to the soft tissue above the heel, okay, to reduce stress on that Achilles. And then more importantly than anything, to manage it, we want to make sure we stretch that tissue. So listen to your kids. When you have a child that complains of this kind of ongoing chronic heel pain or acute heel pain, it's something that should be paid attention to. I would also like to say that typically in 4 to 6 months, the children typically will grow out of this. Most cases that I've managed, we're looking at 4 to 6 weeks. So Seaver disease, something that we treat here in the clinic. Come check us out.